Hi, I'm Dr. Christian Mazer. I'm a dentist at Allure Dental, and we are in the practice of placing dental implants in many situations. And there are times, many times, where we graft bone during those procedures. Sometimes it's to widen an arch, sometimes it's to elevate the sinus somewhat so we can put implants into an area where we don't have quite enough room. But grafting bone and placing collagen matrices are very much part of that process. There are many reasons for grafting bone throughout the mandible and the maxilla. Most of the time, when we're talking about bone grafting, we're talking about grafting bone when we are placing dental implants. Again, like I said, maybe there's a lesion periapical to a bad tooth, or there's an area where the ridge isn't quite wide enough, and we can add like a decalcified bone matrix to the area to give better support for our implants to be successful. Placing a dental implant, sometimes, patients will say it was more uncomfortable to have the tooth removed than placing the dental implant. Basically, there's some healing. Your body goes through a process of remodeling bone around the implant. So the implants are threaded, we put them up in there, and then they're held kind of mechanically by the threads in them. Over a period of 3 to 4 months, your bone is remodeling around that implant to incorporate it into its structure. When we need extra bone in the area, we put a decalcified bone matrix, and your body also mineralizes that matrix and makes it part of your bone to help support the implant. So there is healing. It's typical normal healing. Sometimes it's a little bit uncomfortable for a few days, but for the next 3 to 4 months, your body is just behaving normally and remodeling bone around that site. Successful bone grafting gives us more surface area around implants, gives us a wider ridge to work with, gives us maybe some more depth that we didn't have before. Even if we're lifting, if we're elevating a sinus floor a little bit, it gives us some extra length, and it lets us engage a couple of layers of the natural bone, and we can push some bone grafting material up into the sinus. So we're engaging different layers of what we call cortical bone to make the implant interface with your normal bone more solid. Some of our biggest, most successful cases, and I know this is the same for Dr. Murray, some of the people that are just at the end, like they've let things go so badly that they're at the point where they're going to be doing dentures, and they've lost bone over the years. They've lost kind of a tooth at a time, one area to another area over time. They've lost bone. We're very limited on sites to put implants. We can go in and we can graft bone in those areas. We can apply some dental implants, create a prosthesis, a denture, maybe a denture without a palate in it even, and then they can begin to function with a prosthesis that's kind of tied back to them. They can still have that sense of feeling that pressure sensation, at least when they're chewing and biting, and they can function better. And being able to graft bone in those areas makes a huge difference in that process. If you're considering dental implants, you've been told there's not enough bone in one area or another, that you pick up the phone and you call us at Allure Dental or schedule an appointment online. We have, you know, 3D imaging that we can use to place implants, to plan them virtually on our software to see where implants are possible, where they're not possible, and where we might need to do bone grafting or not do bone grafting.